An Ontario Health Team is a localized approach to care that's driven from the bottom up.
The collaborative here is a collection of community partners and senior leaders that are working together to form the Hills of Headwaters Ontario Health Team, but also really looking at transforming the way we deliver care across Dufferin-Caledon.
Family physicians, hospital and mental health services, palliative and long-term caregivers working together to improve the health and well-being of everyone in our community.
The advantage of the new system is that the patients would no longer be responsible for having to transfer information between all of their providers, that the system would do that on their behalf in a very seamless way.
We live with the conditions that we have 24/7, 365. We know ourselves better than anybody else. By having patients and family advisors involved, it's definitely going to refocus the whole effort to make sure that the patients are the center of the discussion.
It's important to have their voices heard because patients are on the receiving end of it.
When clients come in and see our navigator or our counseling staff, they have the ability to tell their story once.
So the benefits for the collaborative and the service providers are that they'll be working closely together, and it really helps to generate a collective effort in providing care.
Oftentimes when my worker goes into the home to address a personal care need for a senior, they often come out of that home with a to-do list for other things like appropriate housing, transportation.
My patient needs social work and they need Meals on Wheels and they need hospice support or whatever they need. That should be one phone call.
So with that understanding emerges an opportunity for a real holistic care plan.
There is not one entity, there's not one group who can do everything. We are definitely better together, and this collaborative is only going to make us stronger.
The Hills of Headwaters is the best kept secret to become an Ontario Health Team. We look to hear the patient and community's voice to make sure that we don't make a provider-centric model.
A truly patient-centered model of care where the services are being wrapped around the patient versus the patient having to navigate the gaps in the silos of care that exist in the province today.
Part of the excitement that we have about the changes in the collaborative is how paramedic protocols will change. Certainly we're looking at things like alternate destinations.
The Hills of Headwaters Collaborative is all-inclusive and welcomes anyone and everyone that provides any type of care or support across Dufferin-Caledon to become part of our team to ensure that we are providing the best care possible for those patients.
We know that these Ontario Health Teams are going to work to coordinate and provide seamless access to the care and services people need in their community. We at Public Health are sharing our expertise and local data to make sure the collaborative has what they need to build healthier communities.
I believe that we'll have the opportunity to provide input and thus have a more proactive role as opposed to being reactive.
This model will change how we collaborate with health organizations by giving more resources and opportunities for the officers to use when they are responding to people in need or in crisis situations.
So I think with the OHT, we're really examining palliative co-design team from early identification all the way to bereavement. What are the services that we should have in our community and how are we going to provide them is really exciting.
As a patient, I discovered so many things. You know, it's very different being the professional sitting next to somebody talking about their end of life and their young child. Very different than actually being that person.
The hospital called me, we're putting together a patient advisory committee. Would you be interested? And I said, absolutely. We've rewritten documents and stuff for the hospital. I'm on the collaborative working on the ER team where we're redesigning the ER, and I'm extremely proud to be part of everything.
I've had the experience of being here for 35 years and we have had an amazing community, but already I can see the benefits that are taking place as a result of us getting together, and I can only imagine what the future will bring.
The real strength we have is the relationships we have between the people in our community and the willingness to step up and care for each other.